So happy to have you here. This is our weekly seminar series, and today we are really honored to do this seminar in conjunction with the Center for Inequality and Poverty Research here at Davis. This is a joint Chipper CIPR seminar, hopefully our first of many. And one of the directors of CIPR, Jacob, is going to introduce our esteemed speaker. Thank you so much, Jacob, for partnering with us on this event.
Yeah, this is very exciting. This is the first of what I expect will be many of these sorts of opportunities to bring our two centers and our affiliates together. I think there's plenty of overlap in interest and expertise. I think this is great. So thank you very much, Courtney, for the invitation to partner with you. And especially thank you for setting up this opportunity for us to hear from Professor Erin Hamilton from the Department of Sociology here at UC Davis. Professor Hamilton is an expert in migration, particularly migration to and from Mexico, sort of between the US and Mexico. Is also the author of a recent book on, what's the title of the book, Erin? I'm sorry, Population Health in America.
That's it.
As well as an upcoming book that will be published in the spring called The Departed, I think. Is that the right title, Erin?
No.
Your second book? Oh.
That's okay. It's The Returned.
The Returned.
Close enough.
And if you wanted to say like a couple of things at the beginning about what that book is going to offer us, I would love to hear it. I think the audience would as well. But I won't talk more. I think it's time for us to hear from Professor Hamilton.
Okay. Thank you, Jacob, and thank you, Courtney and Bill, for organizing and having me here today. Yeah, I'll save the return for later, and you surely can ask questions at the end. I hope that there's a lot of time at the end for discussion, because this is the first CPIR CHPR joint seminar, and so I really see this as an opportunity not just to share my research, which I'm excited about, but also to think about how we might more closely collaborate on issues of common concern related to health and health equity and poverty and inequality. And I wanted to contextualize my work a little bit before jumping into the substance by explaining that I'm a demographer and population health scientist, and I was trained in sociology. So I was looking at the Chipper website, which is very cool, and I invite those of you who aren't affiliated with the center to check it out. But I was excited to see population health come up a number of times, like, for example, in the prevention policy and practice group at the Chipper. But I still think that the disciplinary difference between what I do and what you all do could be a barrier. And so I wanted to just explain before I do it, what it is that we do and how I see our work as different and complementary. And so the main difference I think I see between our work, and please feel free to disagree with me, is that it's the degree to which the work is applied, or designed sort of with the idea of implementing policy or affecting practice with that goal in mind. So the primary goal of my discipline, sociology, which at least the one that I think most of us agree on, is to create knowledge, and specifically to build our understanding of the social world. And as a demographer and population health scientist, my goal is to build knowledge specifically about population change and composition as it relates to health inequality. So today you're going to see that the work I have done and that I'm presenting on this topic is less oriented towards solving a problem than it is towards describing a problem. But demographers and population health scientists argue, and I hope you'll agree, that this kind of descriptive science, where we bring the best population data to bear on a problem, is really important as a starting point for identifying problems that need solving. And I'm excited. What I hope to hear from you all, thinkers at the Chipper, is how you can take this information and make use of it in your work and healthcare policy, as well as clinicians. So with that said, I'm going to present work today on the well-being of the binational population of children of immigrants in Mexico, living in Mexico and the United States. I'm going to show a lot of population data, and the project is kind of big and sprawling, and so I've pulled in pieces from different components that have been in collaboration primarily with Claudia Masferrer, who is a demographer at El Colegio de Mexico, but also with three fabulous graduate students in sociology at UC Davis, Sarah Alki, Angelita Repetto, and Michael Middleton. So this is the population of Mexican-born immigrant children living in the United States. So these are children who were born in Mexico, but were counted in a US Census or the American Community Survey. And we're looking at how that population has changed over time. And what we see is that the population of Mexican-born children living in the United States doubled from about 500,000 to over 1 million from the period from 1985 to the year 2000. And then it peaked, plateaued, and began to decline after the year 2005. And in the most recent year shown here, 2020, the population of Mexican-born children living in the United States was smaller, or about the same size as it was in 1985, about 500,000. So there's a lot of attention, and I'm sure you're all aware, regarding unaccompanied minors who arrive at the US border, but the vast majority of Mexican-born children living in the United States live with at least one parent who's also a Mexican immigrant. So these are immigrant children in immigrant households, and there's a large body of research literature studying this population. So here are just a few of the beautiful covers of books written by sociologists and closely connected social scientists on these immigrant children and immigrant families. And these books are accompanied by a much, much larger body of research published in less visually beautiful form of articles. So in other words, we know a lot about children of immigrants in the United States. And the questions that this literature asks are the following: how are children of immigrants doing? How are they doing in school? What health and healthcare needs do they have? Do they experience socioeconomic mobility in adulthood? And sort of beyond this kind of characterization of their well-being and needs, what social forces are responsible for or shape the well-being of children of immigrants, with attention to things like the pre-migration context in the country of origin, the migration process, family structure, dynamics and resources, community support structures, and then institutions like the system of education, healthcare system, immigration policies, and enforcement in the United States. So most of this work on children of immigrants in the United States answers questions about this by comparing migrant children to non-migrant children and to children in non-migrant households, kids who were either born in the United States or who had lived here for a long time, or to children themselves over time as they kind of spend time in the United States. And so a key assumption of this work is that children of immigrants arrive in the United States and then or are born here and then remain here. And the problem with this assumption is that in the case of Mexico-US migration, some children of immigrants immigrate, that is, leave the United States to return to Mexico, and we should be concerned about their well-being too. So the few slides ago, we saw the population of child immigrants from Mexico living in the United States. This slide shows the symmetric population in Mexico. So this is the population of children who were born in the United States and live in Mexico. And what's important here is that this population is also quite large, and it grew rapidly in the first decade of this century from about 250,000 across these three age groups in the year 2000 to 500,000 in the year 2010. So like Mexican-born children in the United States, the large majority of these US-born children in Mexico are the children of Mexican immigrants. So they were born to immigrant parents in the United States, and then they migrated with their parents back to Mexico. And as this population grew in the first decade of the 21st century, researchers like myself responded by studying their well-being. But this is a much smaller body of research than research on immigrants and children of immigrants in the United States. There's only one beautiful book cover to show you. But you can see from the titles of these articles that people are studying things very similar to what we study in the US, like well-being, education, and healthcare of US-born children in Mexico. And also similar to the research in the United States. In the research on kids, US-born kids in Mexico, they compare US-born children in Mexico to Mexican-born children in Mexico. So how are children who migrate to Mexico from the United States compared to those who were born and grew up there? So the assumption here is that the non-migrant group in Mexico is the standard or average to which immigrant children should be compared, because that's where they're expected to stay. So the book shown here by Victor Zuniga and Sylvia Giorguli offers a really nice definition of these kids as the 0.5 generation. So this is a clever title or label for this group because it recognizes that US-born children have immigrated, but they've immigrated to their parental homeland. So this label, the 0.5 generation, draws a contrast to child immigrants in the United States who are called the 1.5 generation. So these are kind of symmetric child immigrant generations. And these are the key definitional characteristics of the two generational groups. The 0.5 generation was born in the United States, but they live in Mexico because they migrated as a child. The 1.5 generation was born in Mexico, but they live in the United States because they migrated as a child. They also have different citizenship rights as a result of the circumstances of their birth. So both groups have birthright citizenship, meaning they have the right to citizenship in the country where they were born. So in the 0.5 generations case, they have US citizenship. In the 1.5 generations case, they have Mexican citizenship. Both countries also grant citizenship to the children of citizens, meaning that 1.5 generation children have the right to US citizenship if their parent is a US citizen, but that's uncommon. By contrast, the 0.5 generation has the right to Mexican citizenship if they were born to a Mexican citizen parent, and this is common. So what this means is that the 0.5 generation here is composed of binational citizens with the right to live, work, and travel between the two countries, whereas the 1.5 generation are mostly Mexican citizens growing up in the United States without citizenship rights. And to give you kind of a demographic sense of these two populations in comparison, we can look at them side by side. So the 0.5 generation on the left, the 1.5 generation on the right, again, by census period with the groups broken down by these three child age groups. And so one point to make clear is that they have, the two groups have different recent demographic histories, with growth in the population of the 0.5 generation in Mexico and decline in the population of the 1.5 generation in the United States. And historically, the 1.5 generation was much larger. But the second point I want you to notice is that by 2020, they were equally sized. So in 2020, the number of US-born children living in Mexico, 500,000, was about equal to the number of Mexican-born children in the United States. So you might be wondering about US-born children of Mexican immigrant parents who remain in the United States, which is what we call the second generation. This is an important population of children of immigrants as well. And this is data showing the origins of this population. So these are birth data. So this, in each of these bars here, we see the count of births in a single birth year of children born in the United States to a Mexican-born mother. So you can see that the number of births to in the United States to Mexican-born women grew steadily from 1985 to a peak in 2005, and then it declined thereafter. So these US-born children, if they remain in the United States, are called the second generation. They are the US-born children of first generation or immigrant parents. The great majority of the second generation remains in the United States. So this is the 0.5 generation on the left. It's the exact same data that we saw 3 slides ago. It's just on a different scale now because on the right is the second generation and it's much bigger. So to make sense of how this graph compares to the last graph, this yellow bar here for 0 to 4-year-olds in the year 2000 in both countries is the birth cohort born between 1996 and 2000. And so though if we were to go back and kind of count those 1996 to 2000 birth cohort sizes and then distribute them between the two countries, we can estimate what percentage stays in the United States and what percentage goes to Mexico. And it's a small rate of migration to Mexico, about 6%. And we can also conceptually compare now 3 generations of children of immigrants. The second generation was born in the United States. They grow up in the United States. They are not child migrants. They have US citizenship by birth. The majority of them have the right to Mexican citizenship by virtue of their birth to a Mexican citizen parent. So the comparison of these three groups across countries using binational data, all children of immigrants, sets up the possibility for interesting questions about how birthplace, citizenship, and migration, as well as place of childhood and settlement, are related to child well-being. And these are the sorts of questions that my research group, the people I mentioned in that first slide, are working on right now. So specifically, how are these three generations of children of Mexican immigrants doing? How are they doing in school? What health and healthcare needs do they have? And we're just getting started. So this is work that I'm going to show you in the next couple of slides with some findings from our research is extremely preliminary and the beginning of what I hope will be several years of analysis and thinking about these questions. So I'm very excited to hear what thoughts and reactions and comments you might have for how to make this work more useful and interesting to you. So the first set of preliminary findings that I will show you draw from our analysis of US and Mexican census data. So we're using the most recent Mexican census data, which come from the 2020 Mexican census, which was almost completed just before the stay-at-home order went into effect in March of 2020 for the pandemic. The US decennial census in 2020 was not completed before the stay-at-home order went into effect. So we are comparing the 2019 US American Community Survey data to the 2020 Mexican census to kind of make sure we're not having major pandemic related disruptions in the analysis. Is there a question? Okay. Is there a question?
No, I think you're good.
Sorry. Okay. I just saw the thing in the chat. Okay, so the second analysis, which is a little further along, is work I've done combining Mexican and US birth records to analyze infant health. And in this work, I compare births in the United States to Mexican-born women and US-born women of Mexican origin to births in Mexico to US-born women and Mexican-born women. So I'm going to start with a few slides showing just some characteristics of the population of binational population of children of immigrants. So this is just a lovely map to look at. This is just showing us where these children are living. So this is just child migrants. We're excluding the second generation here in the United States. So the kind of equally sized populations of the 0.5 in Mexico and the 1.5 in the United States. And you can see that they're clustered on the border in the US Southwest, a few states where they reside in the US Southeast and Midwest. In Mexico, there's a more extensive distribution of the 0.5 generation, although there's still a clustering in the border, but you can see that there's US-born children located throughout the country. In California had the largest population of Mexican-born children of the US 50 states, with nearly 150,000 Mexican-born children living in California. So about a third of the US population of the 1.5 generation Mexican-born children living in our state. But they only make up about 1% of our child population of all children in California. They're actually expressed as a share of the population of children. The 1.5 generation is a larger share of the Texas population. And it's an even larger share of the populations of children in the Mexican northern border states of Baja, Sonora, and Chihuahua, where in Chihuahua, 6% of all children were born in the United States. Okay, so here's some beginning data showing some answers to some questions about child well-being across 3 generations. In green is the 0.5 of US born in Mexico, and then we have the 1.5 Mexican born in the US. And the second generation is US born of at least a Mexican born parent living in the United States. And we, Claudia and I, constructed 2 measures of educational lag or delay or exit. So this is simply using highest level of educational attainment for specific age groups. And so in the first row here, we're looking at the percentage of 15 to 17-year-olds who have not advanced past primary school. So that is to say that they haven't started junior high school in the United States. You can see those rates are very low, near 0%. And they haven't had any years of secundaria in Mexico. So that's 4%. So a much higher share of US born in Mexico have not advanced past primary school or elementary school. Just so you know, this is about half the rate among Mexican born 15 to 17-year-olds. So if we were to just ask questions about how immigrants are doing in Mexico by comparing the US born to Mexican born in Mexico, we would say, oh, they're doing great. They're twice as likely to advance past primary school. When we look at 17-year-olds and whether they have advanced past junior high school, meaning have any years of high school in the US or any years of preparatoria or technical school in Mexico, we see about a third of the US born 17-year-olds in Mexico have not advanced past junior high school. And that's much higher than the rates of children of immigrants in the United States. We also looked at disability. So in both censuses, they asked whether each person over age 5 has a disability and its severity. So this is any severity of disability related to vision, hearing, mobility, or cognition, basically a 0-1 for any of the above, the most simple kind of version of that measure. And again, you see a higher rate of disability, so a greater disadvantage among the US born in Mexico compared to the two groups of children living in the United States. This is also higher than the rate of disability among Mexican born children, which isn't shown here, but is 3.9%. It's tricky to compare insurance systems across the two countries. So this is because in Mexico, there are large publicly run insurance systems that provide insurance for private sector and public sector employees. We don't have anything that's equivalent to that in the United States because we have private insurance companies that our employers contract with. So what we did was group any private or public employment-based health insurance into one category. So this in Mexico includes the programs IMSS, ISSSTE, and PEMEX. In the US, it's mostly employment-based, but we also grouped the military insurance here. And then we included self-purchase in both countries in this row here. And the differences aren't that great. But we do see some differences emerge for public health insurance, which is public run programs for low income in the US, Medicaid, or informal workers in Mexico, which was a program called Seguro Popular through 2019. And then after AMLO became president in Sabi. And so this is kind of the program that's supposed to catch people who fall outside of a private or public employment-based health insurance program. And you can see about 1/5 of the US born in Mexico or benefit from that program, compared to 41% of Mexican born in the US are covered by Medicaid, and 63% of the second generation US born and Mexican immigrant parents. And then in this like leftover category are kids who have no health insurance, and it's nearly half of US born in Mexico have no health insurance, a third of Mexican born in the US, and 10% of US born of Mexican immigrant parents. Okay, so this is what we've done so far with census data to describe some measures of well-being across these three groups. And as I mentioned, we've gotten a little bit farther with the work on birth records. So with the birth records data, we're combining information from Mexico, again, from Mexico and the United States. And we have one reliably measured indicator of infant health across the two countries, which is the rate of low birth weight. This is the percentage of infants that are born weighing less than 2,500 grams, which is 5.5 pounds. So I need to pause and explain that these groups are no longer directly comparable to our child's migrant groups. So we've added Mexican-born mothers as a point of comparison. We now have US-born mothers in Mexico. So in this period, we're using data from 2015 to 2019, births in this period. 10,000, there were 10,000 births in Mexico to a mother who was born in the United States. And it's not possible with the birth records data to tell whether they are the children of Mexican immigrants or someone who goes to Mexico to work or study and has a child while there. And so that would not be the same as the 0.5 generation. But I do have a strong suspicion that the majority of these evidence-based determination, the majority of these children are the 0.5, mothers. A third of them are between the ages of 15 to 19. So this is a rate that's much, much higher than the rate of teenage pregnancy among the other groups. They also have an educational distribution that is similar, much more similar to Mexican-born mothers in Mexico than to the two groups in the United States. Here in green are Mexican-born mothers in the United States. We don't know at what age they migrated in the US birth records. So this is the first generation, may include some 1.5. And then we also have US-born mothers who report that they have are of Mexican origin or identify as having a Mexican background. So this includes the second generation as well as higher generations, third, fourth, etc. We don't know anything about their ancestry, just their ethnic identity. So the key finding here, which possibly doesn't surprise you now that you saw the last slide, this the rate of low birth weight, which higher indicates worse infant health at the population level. It's highest among infants born to US-born mothers in Mexico. So it's higher than it is among Mexican-born mothers by a full percentage point. Notice the immigrant health advantage here in green. I'm sure you're all familiar with the immigrant health advantage literature. So this is a well-known population health pattern where immigrants in the United States have better population health outcomes than their US-born same ethnicity counterparts, as well as then the populations that they departed from. So we observe that in these data too. In the birth records, we also have measures of health insurance, so payment for the delivery, as well as the number across both systems of prenatal care visits. And so these data are shown in this figure here. And so these three bars show us the percentage of births that were paid for by a private or employer-based public health insurance program. Public is the public for people who do not have formal employment or employment-based insurance, so Medicaid in the US and Seguro Popular in Mexico, and then none. And again, we see this 0.5 or US-born in Mexico mothers have the highest rate of births. More than 40% of births are not covered by insurance. The deliveries are not paid for by insurance. The other interesting thing that we observe is a difference across countries in the average number of prenatal care visits. So in the United States, both groups of women, Mexican-born and US-born of Mexican origin, have 10.5 about prenatal care visits on average, whereas in Mexico, it's 3 visits fewer, and there's not a significant difference between the two groups. So it appears to be kind of a country difference in prenatal health care access and delivery. So this graph shows marginal differences in the probability of low birth weight for each group listed here on the y-axis as compared to Mexican-born women in Mexico. So a positive value like the ones that we see here for US-born in Mexico means that these groups have a higher probability of low birth weight compared to Mexican-born in Mexico. And the value is expressed as a difference in probability, but you can interpret this one as a 1 percentage point difference. A negative value, so on the other side of this vertical line, which is at the 0 that you can't see here on the x-axis, is indicates a lower probability of low birth weight for that group relative to Mexican-born in Mexico. And these differences are estimated from a series of 4 regression models that progressively control for a greater number of measured maternal and infant characteristics. So in the blue dots, we have estimates from a model that are controlling for maternal age, the year of birth, parity of the birth, and the infant sex. And then in model 2, we're adding maternal education and marital status. Model 3, number of prenatal care visits, and in model 4, the health insurance that paid for the delivery. So 2 main findings here. One is that the models do not explain the higher probability of low birth weight for the US born in Mexico compared to the Mexican born. So there's very little change in these values across the 4 models, even as we control for differences between them and their characteristics. And then the second finding is that healthcare, which is controlled for in models 3 and 4, prenatal care visits here and health insurance here, explains differences in low birth weight across countries. So what we see is that if Mexican origin women in the United States had similar levels of prenatal care as women do in Mexico, they would have had higher rates of low birth weight. So in other words, the immigrant paradox or the immigrant health advantage, at least as compared to women who remain in origin, appears to be accounted for by better or greater healthcare in the United States. Okay, so these are the questions that motivate research, including mine on the well-being of children of immigrants. And in this presentation, I showed some evidence that suggests that US-born children of immigrants who live in Mexico, this 0.5 generation, have greater healthcare, health, and educational disadvantages than children who are born in Mexico and immigrate to the United States, or who are born in the United States of Mexican immigrant parents and who remain there. Why do these differences emerge? So a lot of the research that I showed earlier, which has documented some of the conditions of the US born in Mexico, have focused here on these 3 forces: community support, the Mexican education system, and the Mexican system of healthcare. So in other words, the social and institutional context that US-born children arrive to into Mexico and the barriers that these children face entering the education system, becoming enrolled in healthcare insurance, and so on. The community support component has emphasized problems like discrimination, stigma, teacher-student communication issues, curricular problems that differences that affect child well-being in their communities, schools, and at the doctor's office. So a key hypothesis that I'm interested in, and the one that I'm working on trying to figure out in my research right now, is related to the first factor that I listed here, pre-migration context and the migration process. So as we know, the 0.5 generation are the 6% or so of the second generation born in the United States who, with their parents, immigrate to Mexico. And there are important forces that lead certain families to migrate to Mexico with their children for this growth in the 0.5 generation that we observed in the first decade of the 21st century to have occurred. And so I'm very interested in finding out what those forces are. So far today, I have focused on the role of immigration enforcement and parental deportation, which has resulted in a large number of children whose parents face enforcement consequences or deportation orders migrating to Mexico to accompany their parents. I think this graph helps us remember that the 0.5 generation in Mexico are US citizens by birth, but they are growing up away from the kinds of institutional and social supports that exist in the United States to foster child well-being. When we focus here on the US context, we tend to see the problems in those. And I think this binational perspective sheds a slightly different light on on the kinds of circumstances facing children of immigrants when they migrate between countries. So I'm ending there with a good amount of time for conversation. Bill sent me these questions in preparation for this seminar, and I have to confess that I was totally daunted by them. So the request for me was to list my 3 presentation objectives, which should describe changes that learners like you all can intend to make to your strategies, performance, or patient care as a result of attending my talk. And I felt like I would just return that question to the audience and ask you all to please answer it for me. And actually to kind of get the conversation started, to think about, you know, what kinds of information, ways of thinking about these data, or analyzing them, would be useful for the kinds of applied purposes that you seek to address in your own research on healthcare policy and practice. And then, are there opportunities for further learning or collaboration on these or related topics where we could think about how the combination of this kind of a demographic perspective, population change, composition, description of a problem can be coupled with a more applied kind of intervention-based approach or study of behavioral or systemic sorts of changes that improve the health of people. So I'll end with that.
That was such a great talk, Erin. Thank you so much. I did have one you asked for clarifying questions first, or more information piece, and then I see a few in the Q&A panel and others that we can get to. I was curious when you mentioned that people have the smaller body of literature of people studying the 0.5 generation in Mexico focused on the community and social context. I hope I got that right. That there's something different about communication in school or other things, discrimination. Could you speak more to what you mean by that? I wasn't quite sure I understood. Like, are there language barriers if people were born here and going back? I mean, is it something related to the actual culture of being born in the United States, or that is related to how they're experienced in Mexico? Does that make sense? Like, I'm just trying to make sure I understand what is already known about the topic and how, because your work is building on it in such an important way, but I wanted to make sure I understood that piece.
Yeah, for sure. So there has been some work looking at, I mean, a lot, actually, the bulk of work looking at the US born in Mexico has studied their experiences in Mexican schools. And so there's kind of 2 components or foci of that work. One is on barriers to enrollment. In spite of being a Mexican citizen or a person with the right to Mexican citizenship, one has to go through a bureaucratic process to get those paperwork and the correct kinds of documents in order to enroll in public schools. So there's lags and delays in enrollment that's been documented in a variety of different kinds of data, and then also kind of in more like school-based experience research studies, administrative policy-based studies and things like that. The stuff that you're talking about has taken a different variety of approaches. So some are school-based and look at like how there are both kind of classroom and curricular differences between the systems that make adjustment to school in Mexico difficult. Sometimes this is language barrier, although many of these kids speak Spanish at home, they haven't learned academic Spanish and they've been doing schooling in English. Other things are just like, where are they in math, or where are they in language arts, and you know, how, you know, those kinds of adjustments. And so there's a lot of people who are thinking about how teachers, particularly in the border region, can be attuned to those kinds of differences, or school districts and things can think about how to better serve migrant children who come in with from a different system. At the community level, yeah, there's some evidence that there can be sort of stigma or discrimination against kids or adults who have kind of a US style that might look kind of like more urban, or not urban, but like maybe gang related. And so tattoos or probably these smaller kids aren't in that category, but baseball caps, like certain kinds of US shoes, things like that, that might suggest a kind of criminality or quality that is stigmatized. And this is there is a stigma around return migration and people who return to Mexico, and kind of the assumption is like, well, what went wrong? And so it's not typically like, not often as we might imagine, sort of the return of like, well, and now I've constructed a large home and I'm a successful former migrant with a business, but especially in the 21st century, in the post-Obama period, or second half of the first decade of the 21st century and on, people who returned under mass deportation, there's an association of deportation, and so that affects kids as well. So Jacob mentioned my book, which is coming out in March, and is called The Returned. The Departed, The Returns, it's the same thing. And in that book, we report on data collected with returned migrants in Mexico City in 2019, and there were a number of stories of just like feeling like, I think that's not necessarily specific to coming from the United States, but kind of the immigrant experience of feeling like an outsider, not fitting in when you first arrive, like. For these kids, kind of maybe talking with a Spanish accent, or not always having the Spanish words at the tip of the tongue. And so being identified as gringo, or identified as foreign, or identified as something less flattering than those two more generic words about people who go to the United States and come back.
Yeah, that's super helpful. That's exactly, I was trying to piece that together. I had another follow-up question, but I'm going to go to the it's in the Q&A and I can read part of it out, but if you wanted to look at it yourself. I think the first question was really from Joss, was really about which parent, we have the mother from the birth record, it sounds like, but whether or not they had both parents of Mexican origin or US born father, is there any data about teasing apart the dyad of the parents on these data?
Perfect question. Thank you, Joss. We do in the US, but not in Mexico. So the US has father data on some, not all birth records, but some number of them. So there's some missing data there, but in Mexico, there's none at all. And so there's no way to do that. To do that in the binational data, but people have, I think, done it in the US, looking at the immigrant health advantage and thinking about differences in the parenting group couple in origins. And I will say, Joss, that the work that I've done on de facto deportation is super interesting in terms of who is accompanied by children. There's just very strong gender differences. So women are 10% of all deported people in Mexico, but they're like 35% of people who are accompanied by children. They are not accompanied by the children's father, but men, when they are deported and are accompanied by children, the mother is also de facto deported, so is accompanying the deported father. So it's like family unit return when a dad's deported and it's decided that the children will go with them. But when a mom is deported and it's decided the children will go with her, it's single parent deportation. So there's really interesting stuff going on there that kind of gets to some of the gender stuff in the family that's happening in the family migration process.
Great. And then we have 3 other questions, I think, about the data or the ability to break down the data. And they are by, just to try to summarize and see if you want to take them all as a group, about the actual legal status, the state by state differences. And then I think the third is really about that, which I think sounds like you have, deportation status. Like, is there ability to separate? I'm guessing in these big data sets, not, but it sounds like you have qualitative and other types of data too that can accompany or think about these patterns in more depth. So I'd love you to try to tackle as many of those as you think you can.
Thank you, Courtney. Yeah, so for Brad and Santi, The Mexican census has questions on reason for migration to Mexico that are asked to people who were in the United States 5 years prior to the census. So 2015, if you were in the US and you're in Mexico in 2020, it asks you why you migrated, and one reason is deportation. And we have looked at, what percentage of children living in Mexico, US-born children, Mexican-born children, who are recent migrants, and then other family members are residing in a household with someone who was de facto deported. It narrows the population to recent migrants. So among US-born children in Mexico in 2020, a very small percentage were in the US 5 years prior. So these are kids who migrated a longer time ago. And so we don't observe their reasons for migrating, but we have published some of these findings, or we are in the process of publishing some of these findings. So we did this work with the INADID, which is the Mexican Demographic Dynamic Survey from 2014 and 2018. And those results are published in Population Development Review in an article that came out last year. And then we have a kind of an update to that that's coming out, Brad, in the Russell Sage Foundation Journal of the Social Sciences special issue on deportation and its aftermath, which updates some of these things with the 2020 census data. But no, yes, we do have information about the 1.5 generations parents' legal status, but citizenship only. So we could use the indirect estimation techniques that Migration Policy Institute and Pew use to guess who among the population are undocumented, which I think I have some concerns about for kind of the descriptive purposes that we're doing. A lot of the characteristics that they use to predict whether someone's undocumented are related to things like whether they have Medicaid or other kinds of public programs and their time of arrival. And so I haven't gotten to the point of actually trying to do that, but at this point I'm not sure that I will. So I could be, maybe somebody else wants to do that, and it would be really useful. And yes, Janet, it is possible to break down the data state by state. As you saw, there's a map where you do that. With the 2019 ACS data, the sample is too small to do much more than just like a state estimate. But like further differentiating the characteristics of that state population of the 1.5 generation, you would need to use the 5-year ACS to have more power to do that. In Mexico, that's a huge sample. It's like a 1 out of 14 households were selected for the amplified survey or something. It's a huge, you can do it in Mexico for sure.
Yeah, this is great. I wanted to say, Jeff had a question and I wanted to make a comment, which I have a feeling is going to be related to his question. I was trying to bring it back to sort of our 2 centers and sort of the implications, which I think gets at some of the prenatal question and some of the other questions that are also remaining in the Q&A chat. I think the way my brain thinks about issues like this are really about the effectiveness of policy change on any of these outcomes. And maybe even in a blunt or it's sometimes hard to isolate the effect of a policy change, but just wanted to know, Erin, so for example, it feels like there's some vulnerability of the 0.5 population in terms of, are they at more risk of deportation? Are they have other factors of their immigration status to the US that makes them more tenuous in some way, right? Or less other reasons why they would head back, and is there programs or policies that we could try to, think about from that standpoint and evaluate whether or not we had an impact on any of these outcomes? It's really cool to think about linking data across countries. And I just wanted to throw that as an idea for our Chipper colleagues. Those are the way my brain works. And I wanted to hear your reaction to that and get a conversation going too about sort of the ideas and the questions that you would love to, what kind of questions, does that even resonate to you? What kind of questions would you be interested in from that perspective, or ways for us to think about like a healthcare to sociology kind of, I can see a lot, but I wanted to hear your reactions to that. I mean, it might have been done. It's actually outside of my area of expertise, and sort of like how do you sort of partner in sort of in those ways to think about, um, you know, how the collective data collection processes that could really evaluate something for a population that is not easily seen nor easily captured. You know what I mean? It may be captured in some data sets, but is also moving, right? It also has challenges in terms of how to do work in a deep way, I would imagine.
Totally. And there have been really stellar population data efforts to track people over time. So the survey that I've used is the Mexican Family Life Survey that started in the in around 2002 and had multiple waves. And what it did that was different from other longitudinal surveys that exist in Mexico is it tracked migrants to the US and interviewed them here. And so you do have like the National Employment Survey in Mexico that where you can identify people coming in and out of households, because there's like a 5-quarter follow-up in that survey. And you see the household composition change if there's migration in that period, and you can look at before and after things like that. But you don't see what happens to people in the US. So, I mean, the Mexican Family Life Survey was not designed, however, to be a migration survey. It captured a period of heavy migration to the United States. And so and it has a large sample. So there were enough migrants to do some work looking at, patterns of migration, outcomes of migration. But yeah, it would need to be a design that both sampled to get enough people kind of moving between the two countries, and then did a lot of work to keep in touch with those people as they moved. And that seems like both of those things are really hard and costly. And then in terms of the first point that you raised about the effectiveness of policy change, I mean, I kind of would like to hear what other people who think about these things have to say. But I mean, I certainly think that, I mean, one of the things you said that I wanted to respond to is that, the model methods, the data that I have don't allow me to differentiate between, the characteristics of people who move for different reasons, deportation or for other reasons, from kind of the outcome of those migration processes. And so I'm just observing, okay, in groups of people, how are they different? And it could be because, different groups of people move and they would be different regardless of the move, or because the move itself would affect anyone in kind of a similar way by undermining well-being. And, I think that with the binational data, we get a little bit closer, and kind of thinking about institutional context, we get closer. So like certainly the fact that Mexican and US healthcare delivery and systems are different means that people who move between the two systems are having different levels of prenatal care, and they're having different levels of insurance. But why they move, is still we're not certain most of the time. So yeah, but at a more micro scale, I mean, in thinking about these populations, I feel like we do in the US kind of have a bias towards kids who are here. I mean, we have a program that supports kids who don't have, who arrive as children without legal and do not have legal documents to reside in the country, that then gives access to work authorization through the DACA program. I mean, it's a limited program, but it was a response to a group of kids growing up in our country without citizenship rights. But we also have a group of kids growing up in another country without US citizenship rights. I mean, they can activate those rights by returning to the United States, but their parents can't typically. And so they are there, and they, are facing the sorts of disadvantages I just described. And they are, they're binational citizens. And so I think that we need to think broadly about that, like US consulates or other sorts of programs of support, are the way that we distribute benefits to families in need, should think about these kids as recipients. I just think we need to broaden our view of our population in the context of this mass migration of kids.
Yeah, I totally agree. It's such an, yeah. That's the kind of policy and programs that I think, yeah, like, or school-based, like what are the types of programs and how macro are they, how micro are they, and sort of accommodating or challenging the needs, in which the needs are probably multifactorial, right? There's not just one level of need in terms of how people are accessing the systems. I want to make sure in the last minute, Jeff, if you had one final question for us, and then, oh, you don't. Yeah, I think the only other comment I wanted to make for our shared colleagues, if you wanted this continuing medical education credit, which is actually, Erin, I wanted to say to your first comment, what are the learning objectives and sort of what are people supposed to get out of it? A lot of it is that to get continuing medical education credit, which some of the people who participate in our seminars get, we're required to actually post learning objectives, and people have to sort of self-specify sort of what they gain from the seminar. So it sort of goes hand in hand with that. So you're probably like, why did we ask me? Why did you ask me about that? Sort of was about that. And that's why I use the words patient care and all of that. It's a very narrow way of thinking about it, but then we get credit in both worlds, the CMA world and just our broad seminar world for hosting these seminars. I think at a higher level than that, though, the objectives are really, I think, about the methodological expertise that you bring and the way in which you're approaching the problem. It's just very complementary. It's very different than I would say a lot of the expertise that we have in our center, but super complementary to the types of things that we do. We use a large administrative data sets. We're a little more US focused. I love learning about Mexican data sets. I'm like, oh, I'm so fascinated by it. Huge, national surveys, a lot of the American community survey, all the stuff you're using, but we're using it for other purposes. So we have that in common in terms of how we evaluate large data sets. We do that at the survey level and sort of at the population level, but we also do that more narrowly in healthcare systems or healthcare claims data. So not just, so your prenatal question, we know exactly what kind of prenatal care they received and what was coded in the record, right? Not just that they went, but more granular pieces of information. So we have that in common. And then the last thing I wanted to leave you all with today is this other idea of thinking about the longitudinality and sort of the broader stories of individuals and communities, I think is another thing that is so complementary to what we do. I've thought a lot about, we're thinking about the public health impacts of racism or segregation on long-term outcomes like dementia diagnoses or chronic disease development in later life, right? We think about questions like that and your expertise of demography and sort of how we think about data sets could be really useful for us in our context of how we're linking together data and how we're thinking about that. We tend to probably focus on it in a much more narrow way. And I think, so I just wanted to make some moderator privilege comments about some of the parallels that I see from that level. So I hope you can see the connections there. This is really cool to see. I don't know if you have any final comments for us, but this has just been wonderful to do this together and think about the opportunities. So I welcome anybody who's here to email me ideas of other content or things. I would love to do more of this because I think that's where your brain gets going when you think about the overlaps.
Thank you so much. And I also welcome emails from the audience at Erin Hamilton, UC Davis. So would love to continue the conversation.
Thank you so much. We hope you all have a great day. And this has been a wonderful session. Thank you again. Thanks, Jacob. Thanks, Jeff. Bye.